All right. Hey, everybody. Welcome to the Force Therapeutic Podcast. Glad to have you back. I'm Dr. Brian.
I'm Dr. LaKeith.
All right. And before we get into it, as you know, go ahead and hit that like button. Also share and subscribe so that way you can always tune in and get a little bit of free content from two doctors in mental health looking to give back to the community, okay? Today's topic is going to be why you deserve mental health and what you can expect when you see a therapist. So I got a definition of mental health here. And I'm going to read it to everybody. And we're going to try to operate in and around these parameters as close as we can.
Yeah.
You know, of course, we get to share our experiences as far as how we approach it and things like that. But the definition that we found, and if you Google mental health definition, the Oxford definition is going to pop up. It says a person's condition with regard to their psychological and emotional well-being. Scroll down just a little bit further. It says this includes the emotional, psychological, and social well-being of a person. The reason why we're doing this topic is because I feel, and I brought this to my younger brother, that people are not aware that mental health touches more areas in their lives than they think it does. Most of the time when people think of mental health, they think of seeing a therapist, getting medication, a potential disorder, or something just being a little bit off. But your mental health does not just mean something's wrong. It even means when things are going right. Me personally, when I think of mental health, I think of a person's ability to be flexible in every situation that they come across. But I'm going to get into that here in a little bit. I want to start with Dr. Keith's perspective of, so when it comes to mental health, why do you think people deserve mental health?
I think people deserve mental health because when we talk about mental health, we're essentially talking about understanding oneself, understanding one's life, understanding one's connections to those around us. So mental health isn't just this thing of, illness, right? Because when we think about mental health in American culture, it's always been centered around illness, as in asylums in the 19th and 20th century. And even to this day, when we deal with the unfortunate realities of gun violence, particularly mass shootings, where we kind of lean to it's like, mental illness. That mental illness is just one component of mental health, the same way that being sick is just one component of health. It doesn't define health in a broader scale, but it does describe what happens when health goes wrong or it isn't properly treated or we're not being proactive about it. Mental health is this wide category of both proactive steps and reactionary steps. And it's important to have those type of dialogues about the broadness of mental health so that people just don't have like this one tunnel vision way of looking at it as in like, this is where you go to when things are going wrong, versus hearing like, well, actually mental health also includes some very proactive steps that can help mitigate or prevent things from going wrong.
I like the proactive part to it because when I said earlier that it's your ability to be flexible in all settings, there are proactive things you can do to strengthen your mental health. And just like you said, most people think that it just relates to an illness. Like I like how you use the example of mass shootings because that's a tragedy. So most people look at that and go, okay, that's a mental health issue. There's something wrong with that person's mental health. But when we talk about mental health, it's a really broad thing. Like for instance, those proactive things. I'm very big on people getting to know their emotions, right? Like being able to sit and literally understand what emotion that you're feeling in that moment. That is a part of your overall mental health because if you're able to identify what you're feeling, it not only helps you to learn how to regulate it. Regulate simply means you're able to withstand it without letting it overwhelm you and you still operate according to your values. So you're able to regulate it when you're able to name it, but then also you get to be able to take a step back and be able to go, this is what I'm feeling. If you can name it, then you can go ahead and go, why do I feel this way? You're able to talk yourself through those steps. So being able to name your emotion is one of those proactive steps. There are many, many more proactive steps. So when I say being flexible, I simply mean that example I gave there. Because you are always going to be you, but then, you got to suppress certain areas of yourself, right? Like, for instance, the you when you with your friends ain't the you that's at work.
Facts.
You got your Harvard voice on at work.
I got my Harvard voice on now.
Yeah, you right. I got my Harvard voice. I got my Harvard voice on right now. You went to Howard or Hampton. You went to North Carolina A&T, wherever you graduated from,
exactly.
Right?
Sophistication.
So, but the thing is, though, being able to recognize that this setting requires it. and discerning that I'm not being a fake person in this moment. No, there are certain settings that require certain parts of who you are.
Yes.
A part of your mental health, at least to me, is knowing that certain parts of you have the room to manifest in certain spaces. Like the you at work is not the you that's going to be the you at home. Another part of your mental health is how well you connect with people. That social part. Are you able to connect with your friends, your significant other, your parents, your coworkers, children, things like that? Do you want to speak on that a little bit, little bro?
Well, certainly. So our relationships are one of the biggest factors in our mental health, right? If we have healthy ones, and this isn't even just made up, this is what research shows. Like particularly when we have been fortunate enough to make it into our senior years, the thing that tends to keep seniors going for as long as they possibly can is connection. So whether they feel connected to their peers, whether they're still connected to their children, their grandchildren, their siblings, whoever's around. So we know for a fact that connection plays a big part in our mental health. We've seen what happens when people feel completely cut off and isolated. That's usually around the time they show up in settings in which we work, as in like, okay, so we're dealing with someone maybe who's displaying some antisocial behaviors. We're dealing with someone because they haven't been able to connect with other people. They're very emotionally dysregulated, which is just our fancy way of saying people who have a hard time really managing their emotions and appropriately channeling them based off of whatever setting that they may be in.
I'm actually glad you brought that up because we can go back and talk about that in this as well, because emotional dysregulation is a big thing. It's often diagnosed.
It's diagnosed with a lot of misdiagnoses happen.
Right. A lot of misdiagnosis. So emotional dysregulation, because now that we're here,
Yeah.
and already segued to it, emotional dysregulation is not a mental health disorder. It is a feature in a lot of mental health disorders. So what happens with emotional dysregulation, and if you're listening to this, and this sounds familiar, I just always like to give people the compassion they deserve. You didn't do this to yourself. But emotional dysregulation, if you could think of it this way. There's a scale, right? There's a scale that's -10 and +10 with 0 being in the middle, right? So the negative numbers are those negative emotions, right? Sadness, anger, things like that. The positive numbers are those positive emotions, joy, happiness, surprise, and things like that. So the average person, if they grew up in a healthy environment, when they're at a state of 0, which is neutral, right? But if something happens, they can go from 0 to -2, back to 0 to -4, back to 0 to 2, back to 0 to +4. Okay, that's how people who tend to have a healthy sense of themselves and healthy relationships, they slide in that area a little bit. People who suffer from signs or symptoms of emotional dysregulation, they go from 0 to -9. So when they're mad, where most people would just be slightly irritated, angry, they're pissed. They're ready to fight. They jumped. They went from 0 to 9. Or on the positive side of which most people don't take in consideration, instead of going from 0 to 2 or 0 to 4, when they're happy, they went from 0 to 9. Now that we got people out here impulse shopping, promiscuity, things like that. You're struggling with your finances because you're so happy you're just going out spending. You know, you want everybody to have a good time like you're having. So I just wanted to touch on that because emotional dysregulation plays a factor in many things. And the reason why I said it's not your fault is because usually it's the interactions that you have had throughout the course of your life that have caused you to be in this state.
And I'm glad that you mentioned that because since we're on the topic of like mental health and the broadness of it, because what you described, particularly in our community, when we see someone present that behavior, what's the first diagnosis we go to?
Bipolar disorder.
Exactly. And
black people quick to
say
be like,
you are
man, he bipolar.
And I wanted to point that out because of the fact that, one, we should never get into practice trying to diagnose people and label them. Not saying that anyone should ever be ashamed that they have a mental health diagnosis, but we don't want to mislabel people and get that thrown at them in that particular context, not even in a positive way. Two, it's also a case of when we throw that label out there, most people, and no shade to anybody, don't fully understand what bipolar disorder is and what would meet the criteria of it. So just to let y'all know, it's just safe to say, or better to say, someone's just feeling very emotionally dysregulated, where like their feelings may be all over the place, or they're running one far end of a spectrum to another far end of the spectrum. But to bring it back to one of the questions that you asked in regards to our relationships, because I'm glad you gave that analogy as far as like zero being neutral, and then you have like a positives and negatives. Few things in this life, maybe outside of finance, will have you going all up and down that spectrum.
Yes.
Like your relationships.
Correct.
When they are going very well, you feel things can be like a perfect 10. When they're going very wrong, you can feel as though you're at a negative 10. And relationships play a very important part in our lives. And one of the things I appreciate about mental health, what it does is it helps you identify two things. One, what is a healthy relationship, and do I have those healthy relationships? But then two, if it's a situation where I'm stuck in relationships or I am participating in relationships that aren't healthy, how do I either manage those relationships? Because sometimes it's difficult to let go of a negative relationship. If you're someone who really loves your parents, and even though your parents may not be healthy for you, it's not as easy just to be like, I'm not going to talk to them anymore. But it is a case of trying to figure out, how do I manage that relationship in a way that's healthy for me, still allows me to have them in my life, but doesn't put me in harm's way. And then, I lost my train of thought on that one. I'm sorry. Now I'm back on track. And then also another part of it is it helps you identify if those relationships aren't able to be managed or regulated, what does it mean to let it go, and how to let it go, especially if you are very much emotionally attached to it. Because usually the negative feelings that we have about relationships, they're not coming from a place of like, oh, I'm just ambivalent about this person, I don't care about this person. Usually those more extreme negative emotions come from a place of, how dare this person hurt me, or how dare this person not love me as much as I love them, or them violating something, or us feeling as though they don't appreciate or love, or whatever it is, usually leads to those extreme negative emotions that impact us. So relationships are very pivotal to our mental health, or that cliched saying, even though it's true, no man's an island.
No, and I want to make this clear, and producer, you can make this a reel if you want to as well, by the way. I really want to make this clear that if you're suffering or struggling with something, you didn't do it to yourself 9 times out of 10. It really is a combination of multiple relationships across the course of your lifetime. That's how you end up with attachment ruptures. Attachment ruptures are when you've tried to go ahead and connect with significant people in your life, whether it's your parents, siblings, or close friends, but yet there's a strain or a blockage that prevents it. You can't connect with your parents because they're always yelling. You have a hard time making friends for whatever reason it is. What happens is that in a neurological sense, your fight or flight system, right? Your fight or flight system will look at you attaching to people as a potential threat. So therefore, when you get close to people, now granted, there's more nuance to it. I'm kind of just putting it all in a pretty package, but when you have multiple bad connections with people, significant people in your life, your fight or flight system looks at engaging as a potential threat. And then what happens is that potential way of looking at it will manifest in different ways. You argue a lot with people, or you find yourself in a position where you just don't trust a lot of people, or you're anxious about, is this person going to leave me? Because at a certain point, everything that has happened to you puts you in survival mode. It's kind of like I struggle with maintaining relationships or connecting to people that now, without you even realizing it, you're now in survival mode. So I always like to tell people, you didn't just wake up and do this to yourself, or you didn't do it to yourself at all. It was a series of things that have happened over time. So when we talk about why people deserve to have mental health therapy or assistance with it, is because it's a lot broader than that. Like, for instance, you can pick up books and learn, like self-help books are actually a really, really good resource. Books that help you to better attune with your own state of being, your emotions, how your bodies react to your emotions, teaching you how to think about different things, like noticing how you think about things. One of the best things I like to tell clients to do is journaling. Journaling is a really good, useful tool because it helps you to write down your thoughts and it helps you to see how you think about different situations. It really does touch on other things. And I actually want to segue to that, little brother, as far as like, what are some of the other areas where a person's mental health touches their life where they don't think about it? Like they're not aware that your mental health plays a big factor in this. And when I say mental health, I'm literally talking about your emotional, mental, and social well-being. Like, what are some other areas that where people don't think that this is a factor in the equation?
Oh, goodness. That is to be honest with you, almost all areas. So career-wise, if it's a situation where, let's say, you're in your career maybe 10, 15 years, but you feel as though you're stuck, but you know you want to move upward, but you're not necessarily sure what's holding you back. And you take time to kind of think about, well, okay, why aren't you seizing opportunities, or why are you not being more proactive? In that scenario, it could be several different things, but they all lead back to mental health. As in, like, I feel as though my job does not invest in me, and it's a toxic environment. So therefore it makes it difficult for me to want to perform in a way that will allow me to transcend, because I don't feel as though they want me to transcend. Whether that's actually true as far as like your job being a toxic environment, or you're just internalizing that for whatever the factors are, that's still a mental health situation. If it's a situation where you're not confident in yourself to seize an opportunity that could lead you to that dream job, that could lead to that promotion, that is a mental health situation, because it's a case of, well, why are we talking? What is going on with this anxiety, and also what's going on with your self-esteem? If it's a situation where, you know, you did someone wrong, and you're struggling to apologize, or you just don't know how to apologize, or you're too nervous to apologize because they won't receive it, that's mental health. Right. So when we talk about mental health, and again, because we're broadening this definition, we're not just talking about when you feel bad, when you feel sad, when your relationships are going wrong. We're talking about a very wide span of pretty much human experiences.
I like how you laid it out, because when you were laying it out, it made me think about your mental health includes how you respond and how you react to things. Like, how well do you navigate stress is going to be determined upon your mental health. Like, literally how you grew up handling stress. Do you even know how to handle certain levels of stress, right? Do you know how to breathe through things, walk away from things like that? Depending on where you are in your life will dictate how you respond and react to different things. That part is very, very critical. One area that I noticed that people don't take in consideration is like their level of where they are on their mental health journey that touches in their life. You already talked about their career. I'm going to talk about their relationships, which we talked about earlier. And I'm not just talking about you, because Keith has already touched on it, but I'm talking about your intimate partner relationships. Like, literally, where you are on your journey will dictate how you respond and receive what your partner is sharing with you. That part is very, very critical. Are you so used to being in a state of chaos and you're not aware of it that you don't realize that you struggle when you're in a state of peace? Because if you're not used to being in a state of peace, and you've never noticed that you're not used to being in a state of peace, you can't sit in it. Because now at a certain point, your brain is a little anxious, because it's like, we're not used to this.
When's the other shoe going to drop?
Exactly. When is the other shoe going to drop? When is the chaos going to happen? Or how will you respond to certain informations? I'm going to steal something from another podcast that I saw. It's about infidelity. Like, literally, no, it wasn't about infidelity. What was it about? It was, okay, all right, here we go. I got it. It's in my head. They were talking about dating, right?
Yeah.
And they said, they were talking about, why is it that when I'm ready to settle down, let me change it. Why is it that while I'm trying to be out here with you having a good time, you want to get with me and settle down? And they were like, yeah, this just requires a conversation. Because then she was like, I was out here for the streets during the summer and I had a really great time, but now I'm ready to settle down. When the host said that really great time part would have took me out, like I couldn't, I agree with her. I was like, wait a minute, hold on. You was having a blast out here like that, and now you want to settle down with me? Like, I can't have a blast with you too? Believe it or not, like, depending on where you are in life with your mental health, you might not have a joking reaction to that. You might take that personal. I'm not saying that certain wounds or certain ways that people communicate with you don't cut deep. That's not what I'm saying. But going back to what I said earlier with how flexible you are in different situations, you will always be you, but can you receive everything and then reel it in a little bit? Or can you healthily express it? Because that's a big part of it as well. People don't realize that there's a healthy way of expressing yourself and an unhealthy way of expressing yourself. To give you the Clip Note version, a healthy way of expressing yourself is being able to know exactly what you're feeling and what you're dealing with. An unhealthy way of expressing yourself is lashing out at everybody because you haven't figured it out yet. You know, you're harming the relationships in your life. But what do you think, little brother?
I don't think that's true. I think that When we're talking about intimate relationships, romantic relationships, it really is a case of, I like to say two things, and they don't necessarily correspond with each other, but they can definitely happen. Is this one, you and whomever it is that you with, you meet each other at the right time in your journey in your mental health, and you're in a place to where so you're able to work with each other. That can definitely happen. It usually happens for a lot of people a little bit later in life when they're a little bit more conscious of themselves. They've had enough time to really be with themselves, work with themselves, and meet someone. And it's a case of, okay, I can do this in a very healthy way that maybe I couldn't do when I was younger. The other way is sometimes you meet someone on their journey, you meet someone on their journey, you on your journey, they're on their journey, you meet, and either one of you or both of you just in a place where like it still has not been figured out. But there's a desire and a ability and a patience, and sometimes it turns into an explosion, but then you guys kind of figure out how to settle the fire to try to get to a place where it's like, okay, we're both in a place where we're healthy.
Okay.
And I'm not saying you have to pick one over the other, because reality situation is how people fall in love. The journey to love is just so unique to everyone. It just is. But what I am saying is that when it comes to romantic relationships, there has to be, whether you're already there or whether you're in the process of trying to get there, the desire to, one, understand yourself, two, understand the person, and then three, really kind of figure out what are the steps we have to work through. And that's also a big part of mental health, as in trying to understanding someone else's experience of this world. Because as you mentioned, it's all of those relationships that shaped you prior to you coming to me.
That's true.
And
So, go ahead. Keep going.
I have to understand those relationships. Now, that doesn't mean I have to become an emotional punching bag. It doesn't mean that I have to endure the brunt of the negativity as a result of those. But I have to also understand that all those experiences have shaped you and brought you to this place where you are here with me. Both those things that I get frustrated with and maybe wish they would just go away, but also all those things that make me love you.
Okay. Switching topic. Well, same theme, different topic. So if somebody was looking for a mental health therapist, what are some of the things that they can expect? Like, what are some of the things that you would want to give people? Because I know what I would tell people. What are some of the things they can expect when they come to see a therapist?
Okay, so when they've already gotten the therapist or when they're seeking the therapist?
When they're let's start with seeking them.
Okay,
That's another type of animal in itself.
it is. So ladies, gents, and everybody in between, I'm going to say this. When you are seeking a therapist, you are going to have to strap on your patience. And by that, I mean this.
Really strap on your patience.
Really. By that, I mean this. First off, let's be transparent.
If you're white, though, you don't really got to strap on to it. And you'll see why in a second. Like, if you are a white person looking for a white clinician, you don't really got to strap on your patience too much.
Well, I will acknowledge before I jump into is this. Depending on your ethnic identity or your racial group, if you're seeking a therapist that mirrors that experience, it does become a lot more difficult for the simple fact that let's be transparent and start with here. The mental health community of licensed clinicians and nurse practitioners and psychiatrists and so forth is already a small population, because let's be perfectly honest, and I'll speak for America. America has not always historically valued mental health. So a lot of people, therefore, did not see the value in becoming practitioners of mental health or psychiatric health, right?
Because if they did, in my personal opinion, it would start while people are children.
Exactly. So we are in this particular field as a whole, we're playing catch up, because with the evolution of America, as far as our technology, our openness, as far as like different identities and issues, different problems coming up because of the technologies and different issues, that we're starting to kind of see like, okay, there has to be something out there to provide support around all of these thoughts and feelings that are coming around these different things. So now we're starting to see like, okay, now there's more conversations about, okay, how do we get more practitioners out there? Because during the pandemic, and I also, to a certain extent, I'm upset and sad by it, but also very, in a weird way, thankful by it, is that the pandemic proved to us that there just was not enough practitioners of mental health. There just wasn't. There wasn't enough clinicians. And now we're having a conversation about, well, how do we change that, right? So that's what I mean when I say you're going to strap on your patient, because one, there's not that many of us. And then two, it's a situation where if you have identified a clinician that you want to work with, in this particular era, and I don't mean this as a bragging right, I just mean this as like, this is a sad reality of where we are as far as like how we've long neglected mental health. Most of the clinicians that you're probably going to work with, they're booked and they have a wait list.
Very much so.
And so that means it really is, unfortunately, having to kind of go through a list of trying to figure out who, above all things, you think might be a good fit, but then two, also what their availability may be. Because again, we are still building, and it just really bothers me to say this, we as a country are still building our mental health infrastructure. It has not been something we've invested in. So as a result of that, unfortunately, now that we are all, because I will include myself in there, becoming more conscious about the power and the importance of mental health, we're still trying to play catch up. We're still trying to build this infrastructure as things go along. So that's what I mean when I say having to pack on some patience, because you may deal with some clinicians that have a wait list. But also it's a case of trying to figure out, well, where do I go to find these clinicians? Most of us, we are on these different directories. Like for instance, there's a directory called Psychology Today, where most of us put our ads up saying like, hey, I'm a clinician, I'm here, I want to support, this is my skill set, my education, whether or not I have availability. Then you have other directories such as Zen Care, Therapy Den, Clinicians of Color, Therapy for Black Girls, Therapy for Black Men, even going through your own insurance company, which I would also suggest doing that too. Calling your insurance company, first off, checking to see if your insurance will cover therapy, but then even asking them, okay, so who's on your directory of providers? And they will either email you or even provide you the telephone numbers over the phone of clinicians in your area who accept your insurance. And even if you want to be more specific within these directories, both online and also through your insurance companies, you can ask them, well, I'm looking for a male therapist, or I'm looking for a female therapist, I'm looking for a female Black therapist. They will give you that list of like the Black female therapists, the Black therapist or male therapists that are within your area that accept your insurance.
So Keith touched on a majority of it, but all I'm gonna, because there's not much more to add to that. He hit it very thoroughly. I would just say that with being patient, you may have to when I said earlier that if you're white, like if you're a white person listening to our podcast right now, right, there's more than enough white clinicians out there. The only thing you would have to deal with is the clinician that you want available. Then you would have to be patient. For every other racial group or ethnic group that's out there, if you find a clinician that you like, or you find one that is of the same race or ethnicity of you, chances are they do have a long wait list. You may have to follow back up with them. So I'm gonna give you a secret. Clinicians are not trained to be business people.
We are not.
Therapists are not trained to be business people. So therefore, they're trained to be therapists. They're trained to be doctors in mental health. They're not necessarily going to always think to follow back up with everybody on their wait list. So it may be incumbent upon you to follow up with them with an email to check in with them. So I do want to share that with you, because when we say put on your patience, there's not a lot of, speaking of Black therapists, there's just not a lot of Black therapists. It's not. But there's a high demand for our services. So you may find your therapist, you may find yourself on a wait list for an extended period of time. You may have to do some of the legwork in order to follow up and check in. And therapists can do a better job as well as staying engaged with the people on their wait list, sending them emails and things like that. So that is what my younger brother was getting on when it comes to being patient. And yes, you do got to you can go through your insurance company, you can go through different directories to find one in your area, or you can just Google the local ones in your area as well. So now,
Also,
go right ahead.
Because I want to make sure we also put this out there. But for anybody who is experiencing any type of acute mental health crisis, one, don't wait for a therapist to call you back. Don't wait for a therapist to have availability. If it's acute crisis where you really feel as though you're in harm's way, one, you can dial 988. That is, and one of the things I will give our government as far as doing very well is having now a number that's just like 911, but it's 988 that you can call to where so they will connect you to crisis resources. They have staff 24/7 crisis counselors, and they even follow up and provide resources as far as like a place where you can go to receive mental health treatment. But then also outside of that, also if you find yourself really, really in harm's way, it is a case of making sure that you do go to your local emergency room. Because I want to put that out there, because I don't want anyone to feel as though they're in crisis and they have to wait. No, don't wait for us if you're in crisis and we're not available. Please, by all means, we have resources for acute crisis or crisis that's just happening in the moment that will at least get you stabilized and then try to connect you to a therapist or other mental health services.
With that being said, because he's right, don't wait. If you're having a mental health crisis, definitely go to your local emergency room. And I was waiting for the motorcycle to pass. Go to your local hospital, and they will check you in, and they will get you the help that you need. So you definitely don't have to wait when you're in a crisis. Another thing that you have to take in consideration is when you look for a therapist and you find one, are they in network, meaning they take your insurance, or are they out of network and they don't take insurance? A big thing that we hear all the time is when people get a hold of us, they go, Dr. Brian, Dr. Keith, or whomever on our staff, because me and Keith are actual therapists who see clients, and we're both college professors who teach as well. So we hear, man, it's so hard to find a therapist that takes insurance. The reason why you will run into the issue of not finding a lot of therapists who take insurance is because insurance companies do not pay out. How do I say this properly? The cost of living in Washington, D.C. is a lot higher than what insurance companies will pay a clinician that accepts insurance. So that's why you're going to run into seeing a lot of clinicians that do not accept insurance, but they'll offer you what's called a super bill, where you take the overall bill, they'll put it on an official invoice, and you take it back to your insurance company, and the insurance company should reimburse you a percentage of whatever you paid in therapy. Now, if you find a clinician that does accept insurance, chances are, and I'm not saying that clinicians that just take out of pay pockets don't run into the same thing. I can promise you from experience that, because we accept insurance, as a clinician that accepts insurance, there's a wait list. There's a wait list, because just like you were looking for somebody that took your insurance, everybody in that same insurance network that you're in was looking for insurance. So if you're looking for a therapist and you find yourself running into a position of not a lot of therapists take insurance, that's exactly why. Because the amount of money that insurance companies pay out, it's not paying out enough for most of the big areas that therapists live in. So you have to take that into consideration as well. But let's say you actually find a therapist, right? You find a therapist that you like, whether it's insurance or out of pocket. Did you want to share any thoughts about insurance or out of pocket?
So with insurance and out of pocket, I would just say this. One, if you can find a therapist that accepts your insurance and you feel confident after doing a consultation, because that's another advice I would have, before you agree to anything, before you sign any intake paperwork or anything of that nature, ask the clinician, well, hey, can we do a 15-minute phone consultation? And this will allow you to kind of get a feel for whether or not, one, based off of how they converse with you, if there's someone that you feel as though you can actually talk to, but then two, you get to also kind of investigate whether or not you feel as though they're going to be able to help you. Now, granted, I know that's a lot to put in on a 15-minute consultation, but with that being said, though,
it ain't never 15 minutes, y'all.
That's also true, too. I was going to say that.
We do free consultations all the time. It ain't never. I know you're going to say it ain't. I just want y'all to know, 15 minutes ain't never 15 minutes in a consultation.
Look, he's not okay. I was trying to save our fellow clinicians as far as like we really say, but he's not lying. I'll be transparent with you. All of my initial phone consultation with clients, I accept the fact that they're gonna be 45 minutes to an hour.
Man, I was gonna say 30 to 40. An hour is wild. But
look, some people when as soon as they hear you, it's like, oh my goodness. You have no idea this, and it's just like, okay, you don't want to cut them off, especially when it's like, wow, that is okay. So getting out their system. But definitely want to do the phone consultation because you want to get a feel for the clinician to see if they could actually, that you can actually connect with them and they actually work with them. But as far as like insurance out of pocket, I'll be transparent with y'all. Look, I'm all about saving the dollar. That's me. But I will also say this. If you can find the clinicians you feel comfortable with that can actually accept your insurance, go towards them. But also I would encourage you to make sure that you know upfront either by talking to the clinician or also contacting your insurance company, knowing your copay and your policy. Because we've had a lot of clients who've come and they know that their insurance covers therapy, but they may not necessarily understand or realize, hey, that deductible that was on the medical side also follows you over on the behavioral health side. So according to that deductible, you still have $2,000 to go, which means that your insurance company is
When he said
expecting
behavioral health, he meant mental health as well.
mental health too. Yes, that deductible that you still have to pay money on, that's not just on the medical side, that's also on the therapy side. So that means that they're saying that you still owe $2,000. Their expectation is the fact that you're going to keep on paying for therapy out of pocket, of degree upon frequency, until you meet that deductible. So it's also knowing that, or sometimes just knowing your copays, because that's important. Because sometimes your copay could be something as small as $5 to something as big as you got to pay $55 for every session. So I would say make sure that you're contacting your insurance company to kind of figure out, okay, well, what's the copay that I would have to pay if I try to get like therapy. Now, out of pocket, I would say this. If there's a therapist that you feel as though that can really work with you, that you really connect with, and you have the funds, by all means, definitely pay out of pocket if you can, if it isn't going to break the bank. And also, lastly, one thing I want to put in there is also having to understand there are some therapeutic services and even some services that aren't necessarily evidence-based, but they still have therapeutic components to them that insurance will not cover. And when I say this, I don't mean to devalue those services, but it's just the fact that the insurance company won't necessarily cover them. So if we're talking like Reiki, if we're talking sound baths, even though those things do have some therapeutic components to them that actually help clients, insurance companies themselves will not necessarily pay for those services. And if you get those services without talking to the clinician, you may find yourself getting hit with the bill that's like, well, wait, I thought my insurance covered the services. No, they covered your therapy service. They don't cover this particular service.
So you should definitely be asking your therapist a couple questions. Like, for instance, that was actually a really good segue. Things that you might want to ask your therapist. Like, for instance, you can literally ask them, you have the right to ask, how long have you been practicing? What is your area of specialty? Now, some clinicians are disorder driven. Some clinicians are really, really good at anxiety. Some clinicians are really, really good at depression. Some clinicians are really, really good with trauma, relationships. There's a gambit of disorders that are out there. Some clinicians are theory driven. They're really, really good with this theory, and this theory works with this population as well. It doesn't necessarily discount the fact that they can't help you, because majority of clinicians, we're trained to deal with a baseline of multitude of disorders that people come across. But you should actually get a good feel for exactly what your clinician specializes in. And I do want to go back to what my younger brother said, because usually your standard copay for your primary care doctor will transfer over typically to being your standard copay when you go see your mental health therapist. So yes, checking with your insurance company to figure out what your standard copay is. It will more than likely be a 1-for-1 swap for the other one. But asking your clinician what is their area of specialty in, because that part, even though like they may throw out a bunch of jargon that you might not be aware of, you can follow up with, okay, how does that disorder, or how does that approach or that theory or that specialty help me with this disorder? Like if you ask your therapist, what do you specialize in? And they say, I specialize in anxiety. Okay, perfect. How do you go about treating anxiety? You can ask that just so you can get a better feel of, do you feel like this person can help you? Let's say they tell you, you say, hey, what do you specialize in? I specialize in internal family systems, which is an approach to therapy, or cognitive behavioral therapy, or EMDR. You can say, okay, what is that? They'll give you a nice little summary of what it is. And then you can follow up with, okay, how can you use that to help me with what I just brought with you in this phone consultation? Mm-hmm. The more that you're inquisitive about things, it kind of alleviates some of the anxiety or the worry that you may feel. And then it gives you a better sense of knowing whether that clinician can help you. So when you find one, there are just certain questions you can ask. If you didn't see it online, are you out of pocket, or do you accept insurance? Do you accept my insurance? Are you able to find my copay, or do you need me to find my copay for you? What are your specialty areas? How can you help me? Okay. And then, of course, the standard, what type of openings do you have? And then pivoting from that, little brother. So let's say that somebody gets through all that, right? They get through the insurance part, they find you, they go into that. What are some of the first couple sessions like, in your opinion? Like, what are some of the things that they can expect when they meet with the therapist for the first 2 to 3 sessions?
So for the first 2 to 3 sessions, and maybe even a little bit beyond that, is honestly, to be transparent with you, it's rapport building. I don't expect you to come into the first session and just open up and share everything. I understand that I have to earn your trust. Because let's be transparent. Yes, this is a relationship that's rooted in me assisting you in this journey and me wanting to be of use in this journey and me being helpful to you in this journey. But also understand that this relationship is also very transactional to an extent and also somewhat contrived. So I understand the fact that we're going to probably have to spend the first couple of sessions with you getting a feel for me as a clinician and me getting a feel for you as a person, as a client, and build some sort of rapport that will allow us to actually engage in a therapeutic relationship towards I can actually be useful to you. Okay. So those first couple of sessions, I will say this. The first session, because insurance companies require it, we will end up doing something called either a diagnostic assessment or a biopsychosocial assessment. Mm-hmm. All that is a clinical interview where I gather all this information about you, both past and present, how you grew up, if there's a history of mental health, where the current symptoms that you may be dealing with as a result of whatever the mental health issue is, what your relationships like, educational background, all that information to give me what we call like a clinical picture of you as a client to kind of figure out, okay, so from what it is that they're telling me, what is going on here? Because we are required by insurance companies, but also by law, from that assessment to come up with a diagnosis. And the reason why we have to come up with a diagnosis is because the diagnosis justifies treatment. By that, what I mean is this. The states, the insurance company pretty much says, we need something that has been diagnosed in this lovely book that's called we are at the DSM-5-TR, that justifies like, okay, this is an actual mental health illness or barrier that can actually be addressed based off of evidence-based practices in order to pay for the services. So in that regard, we have to do that clinical interview within the first 2 sessions. But then after that and beyond that, it really is just rapport building and just me getting to know you, you getting to know me. And then from there, when we feel comfortable with each other, that's when the real work begins. And I'm going to let you talk about the treatment plan because I realized I also left that out of there.
So usually, like Keith said, that when you have to do the clinical assessments or the biopsychosocial assessment, there are a lot of things that we do because it's required of us, right? Diagnosing is required in order for us to be able to properly bill your insurance company, and it informs, it informs our treatment approach. Going to what my little brother is talking about with a treatment plan is that your therapist is going to ask you what are your goals for therapy. If things were different on the other side of the situation, what would it look like? Then from there, based upon the goals that you identify, you and the therapist collaborate on how you approach that healing. How do we get you from point A to point B? So you might come in with something, abstract, like, what's something that I've heard before? Like, I just want to get rid of my anxiety. Okay, fair enough. So a therapist may hear that and go, okay, so you want to decrease the symptoms of your anxiety? Because the reason why is like, you're never going to get rid of anxiety, right? Anxiety is an emotion that's always going to be there. However, the continuing experience of anxiety, we can decrease those things. So you can come in with whatever goal that you need. Your therapist is going to turn that goal into something that's actually achievable. So for instance, if you come in and say, hey, I just want to get rid of my anxiety. Okay, so when you say you want to get rid of anxiety, how has it been manifesting? Like, what have you been dealing with? And then we're going to deal with ticking down the symptoms of that anxiety. From there, we discuss what that's going to look like. I'm going to give more steps, and I'm going to give you markers and things in which that we're going to be looking for to achieve. So then from that, with me working with you, we develop and create your treatment plan. Mm-hmm. So those are some of the things that you can expect. An assessment before, it's usually called a biopsychosocial assessment. From that biopsychosocial assessment, we're going to give you a diagnosis. Usually, though, it's just a preliminary diagnosis. Your therapist is not going to fully know exactly what disorder you have in 2 to 3 sessions. It's not. We could be just looking at the symptom of something. And here's the thing. I do want to say this. the diagnosis doesn't have to be something great or severe. Like people hear diagnosis and they go, there must be something really, really wrong with you. No, that's not what that means at all. It doesn't mean that there's something really, really wrong with you. It's like Keith said, in order to facilitate treatment and care, we have to provide one. What were you going to say, LeBron?
No, I was going to say, to your point, I always tell clients this. Don't be too married to your first diagnosis, because diagnosing, it is scientific, but it's not an exact science. By that, what I mean is you could have a room of 5 clinicians and they could have interviewed you, and you may come out with 5 different diagnoses, which all 5 of them could justify based off of what it is that they saw. And also keep in mind that when we're doing the initial assessment, it's one of those things where when we're talking about assessments, it's what someone's presenting at a particular point in time based off of also some things that we've also discussed that happened in the past. And by that, what I mean is, let's say you're someone who may be highly symptomatic, and you come in one day and you're actually pretty cool. So if I'm observing that you're pretty cool, and we're not necessarily going too much into the details about the previous symptoms, I can come in there and just say, okay, this is like a mood disorder unspecified. As in like, okay, I see something based off of what they're saying, but I'm not necessarily sure what it is. And then we get into the meat of therapy and all of those emotions come out. Correct. And I realize this actually falls into criteria of borderline personality disorder. Then I have to switch up the diagnosis as soon as I become aware, and then justify why I have that diagnosis. So I always say, because since it's a new relationship and we're still getting to know each other, you're going to feel, you have maybe not felt too comfortable enough to where, so you're going to show everything, all the facets of you, to where as though I could get a appropriate or accurate diagnosis. So I always tell clients when they come in, that first diagnosis, not saying they all are wrong, because sometimes they can be very right, but don't be too married to it until we really get to know each other and we hit that 6-month mark where it's kind of like, okay, now we need to reassess treatment, and we need to reassess to kind of see if those symptoms have diminished or gone away, or even if they've increased.
So what Keith is saying also, and another way of looking at it, is the thing that brought you to therapy might not be the reason why you're in therapy.
Bingo.
The issue that brought you to come and talk to us might not be the core issue in and of itself. So don't get married to that first preliminary diagnosis. This is just what we've seen from what we heard from you in the first 2 to 3 sessions. That might not be the core of it at all. Like, for instance, you may feel as though you struggle with anxiety, but it's a byproduct of trauma, some form of PTSD from way back when you were younger. You came because of the anxiety. And we deal with the symptoms of the anxiety. And in the midst of dealing with the symptoms of anxiety, we find out that it manifests from trauma. The anxiety is the result of trauma. So therefore, what brought you to therapy was anxiety, but the real core issue was trauma. So that's why, you can't get married to the very first diagnosis. Yes, sometimes it is spot on, right? It really is spot on depending on who the therapist you're dealing with. But do not get married to that first diagnosis. Another thing is, and I mean this because people think this, when you find a good therapist, while your mental health is a lifelong journey, therapy is not forever. It's not.
This is true.
And I want to be honest, you're going to find your therapist. I got clients like this on my caseload, and I love all my clients. You're going to find yourself a therapist, and you're going to like them. You're going to love them. They're going to heal you. And then after a while, it's time for you to go on and be great. You can always come back, because clients will say this sometimes, I ain't never leaving. I ain't never going anywhere.
And my mind was like, we need to have a conversation.
Yeah, we got to let you go, because just like, and I really mean this, just like we talked about before, where Keith talked about, you got to strap on your patience. Just remember how long it took you to find a therapist. There's somebody else behind you with a similar or worse situation, looking for the same healing that you receive. So when you find a good therapist, and the therapist feels that it's time for you to graduate, and you feel like it's time for you to graduate, you got to move forward so that we can help the next person behind you, okay? It's not meant to be forever. It can be as long as it needs to be. But at a certain point, you got to move on and graduate and go forth. That doesn't mean that you can't come back. So, yeah, I just wanted to throw that out there, because mental health is a lifelong journey, but therapy isn't forever. Did you have any thoughts on that?
Yeah, no. As we always talk about in our agency, the term that we don't use discharge. We
You
use
just graduate.
you graduated from therapy.
Yeah, man.
Because that means you did the work, the symptoms have gone down, you're in a place where you're processing in a healthier manner. You graduated from therapy. You came and did what you needed to do and got from us what you needed so that you can go out here and you can go live your life.
I even thought about giving out free T-shirts to people who graduate from therapy. You come and sit with us, you get a free T-shirt that says "I made it," and that's up to you to wear it if you want to, but it would be a free T-shirt. And speaking of, segueing real quick to that, right? So that's the beginning process in a nutshell. The middle process, Keith kind of touched on, right? Like the beginning process is you looking for one, finding one, knowing certain questions that you might feel comfortable asking with a therapist, and then doing the first 3 sessions, right? What to expect. Then there's that middle part, that part where you're processing. You are learning how your thoughts impact your emotions, how you react to certain situations, whatever way of healing that you and the therapist go through, right? And then it comes to the conclusion. But because I said earlier that me and Keith are practicing clinicians, I wanted to kind of wrap up the podcast on this part as me and Keith will share with you how we approach therapy. You cool with that?
I'm cool with that.
All right, cool. We're cool with that. So do you want to go first? You want me to go first?
I can go first as far as like our theoretical orientation.
Yeah, our theoretical orientation, things like that. Like, if somebody was to sit down with Dr. Brown or Dr. Keith, what can they expect? Like, how do you approach therapy? What do you do?
Oh my goodness! I know some of my college professors are gonna look at me and be like, "Oh God, you did not say that." To be honest, where I'm at right now in my journey,
your peers now?
No, well, technically peers, but I still give them in my mind. They're always my college professors.
The student will never surpass the master, as the good book says.
I would say right now it's in this quasi blended space.
That's right.
Which I know that was one of the worst answers you could get when I was in graduate school. It's kind of like, no, you need to commit to a theory and you need to master it.
They told you that?
Yeah.
Wow, I was never told
Stick
that.
to a theory and master it. And listening to it now, I think what they were getting at was pick a theory, not saying you have to be married to it forever, but pick a theory and master it so that way you can understand how a theory is supposed to.
That context I can agree with.
Yeah, but
if you telling me they said pick one and marry it, I'd have been like, that's not great. That's not great advice.
I'm thinking about I won't say the professor name. I'm thinking about one particular professor who said that, and I don't think that he meant it in that particular way. He meant it in the way that we just described. So it always kind of sticks in my head when he says that, because he used to always hate hearing like blended, because he internalized it as like, so you mean to tell me you haven't actually taken the time to actually really kind of follow a theory all the way to learn it?
I can see that in a training setting for school. Yeah, like if I'm working with a student, I would want you to pick one at this juncture in your career because you're in school.
Yeah. That
way you get comfortable with it. Because if you're dibbling dabbling around, you're going to keep dibbling dabbling around. At least pick one for now at this point in your journey when you're in school. So that way when we transition you to internship, you have some foundation to stand on. But now we're doing like in-house talk.
We did the geeky therapist thing. So for me, it has really come to this crossroads of, one, for my couples, I like to use emotionally focused couples therapy.
That's fine.
I love that. Shout out to Dr. Joe Hansen in Canada. Individual therapy, it really has also become a blend of a couple different things. Like at the moment right now, I am really studying compassion focused therapy. Mm-hmm. So for my clients who are experiencing anxiety, but also experiencing a lot of difficulty with really kind of being kinder to themselves and more patient with themselves. Also, the one that every clinician knows, because it's the most evidence-based one, research one, some cognitive behavioral therapy.
Yeah, that's everywhere.
Especially for my clients who are dealing with, anxiety, but also for my clients who just have a lot of negative thinking, and try to get them to understand that, and more importantly, how to kind of turn that negative cycle into a positive cycle. And also right now, because I blame this on my older brother, also now cracking open and investigating more in-depth, person-centered.
Oh man, yeah, that's bias over here. It don't get.
I'm not gonna lie.
It's a good one.
I'm not gonna lie. One day I was like, okay, you know how you're on YouTube always watching stuff, and Carl Rogers came up, and I clicked the video. I was like,
the reason why I say that's a good, in my mind, honestly, in my head, I'm not gonna lie, it's the best one because it's the one you can always, you're always going to default back to that one.
Yeah,
you are. You're not gonna. and I'm gonna touch on this episode real quick. So let me get into mine before I touch on what I was about to say.
Got you.
My approach to therapy, Dr. B's approach to therapy is I am very, very big on the brain and mind connection, right? So as Keith alluded to, I am an eclectic therapist. I pull from different modalities, but the thing that informs me is what is the neuroscience behind the disorder that you're coming with, right? Mm-hmm. That informs how I approach it. So when I say the neuroscience behind it is when you say you have this disorder, I look for which parts of the brain would be impacted by that disorder. And then from there, I pick which approach that I'm familiar with and want to use. But the basic approaches that I use in therapy include person-centered approach. Person-centered approach is a non-directive approach where I focus on looking at the world through the way you look at the world, empathizing with you, which is literally getting in your shoes and trying to understand how you look at the world the way you look at it. And with that approach, I try to get you to listen to more by the way you think and the way you feel about certain situations, okay? So I'm very, very big on using that as a foundation as well. So what brain areas are being impacted by this mental disorder that you're coming with, and person-centered approach being the foundation. And then from there, because I've taught theories of counseling at the graduate level, of course I use cognitive behavioral therapy because Keith is right. It is the most research approach out there because it gives you so many tools to use. For instance, if you're coming to me looking for techniques in order to better yourself, I'm going to probably give you a cognitive behavior approach or a mindfulness approach. The reason why I'm so big on mindfulness is because that's one of those proactive things that we talked about earlier that can strengthen certain parts of your brain that will help increase your capacity or better your form of thinking to where that those negative thoughts that come in and make you react to things like on an emotional level where you're having strong reactions. Certain mindfulness techniques decreases your reaction to those things. And another approach that I recently got certified in and I plan to use more of in the future is EMDR, eye movement desensitization and reprocessing. Now that's something that I've incorporated into my tool belt. So these are some of the ways that I deal with clients when they come to therapy. And of course, which is something that draws everybody in, is I bring in a Christian spiritual counseling to therapy as an ordained minister because I believe that is a big part of who you are as a person and can be a really, really useful tool in healing those people who are believers in Christ. But to the point that you were saying earlier where I segued and pivoted from is dang, what was it? What was that? What we were talking about where I segued and pivoted from.
We were talking about person-centered, but you also addressed that or segued to that.
Yeah, I did. It is the foundation. It is the base point that. Oh, there we go. It came back to memory. People, I've heard this from clients. And other people who talk about mental health is that people who are seeing therapists is that when therapists learn CBT. They just do CBT. They don't do anything else. And I'm here to tell. I'm gonna wait for that motorcycle to go past. I'm here to tell any clinician that if you're gonna CBT somebody every single session, it's doable, but you got to do that in a non-direct way. Yeah, like you can't be sitting here like you internally can analyze every negative automatic thought, but you don't got to sit there and pull out that daggone thought log or that chart and have them analyze every single thought because
it's not realistic for the client.
Right. So you have clients want to come if you DJ producer, you ain't got to include that part in there because now we're just getting long winded at that point.
I mean, yeah,
I'll ask what part.
All right, I'll tell you right now. The part where I said, where did I segue at? And we started talking about how clinicians.
After you talked about the new practice that you.
Right. Yeah. You could actually stop from that point forward. Yeah. Okay. And then pick up right here at this point.
Gotcha.
All right. You cool with that?
I'm cool with that.
All right, cool. So we picking up right here at this point so we can land this bird. So those are some of the ways that we approach therapy. And these are some of the things you can expect when you look for a therapist. But I just we want everybody to know that your mental health is more broad than what you think. It is actually a tool that you can, it is actually tools out there that you can use to strengthen your mental health because your mental health is just as or even more important than your physical health because your mental health is going to be the thing that helps you to achieve success in achieving your goals in life. I just wanted to say that in closing. You got any final words, little brother?
I'm gonna take it one step further and just be bold and say mental health is life.
It is.
It is life. It is how you see it. It's how you experience it. It's how you process it. It is life. So when you guys think about it, I want you to think about life in its totality, because that is essentially what we're talking about when we say mental health.
Oh, yeah, he's right. But with that being said, like, comment. Actually, when you comment, we actually do respond back to you. I want you to know that. It'll probably be me responding back to you.
Yeah, because I don't know about y'all. I can only get into about 5 minutes of me hearing myself. And then I'd be like, click.
Producer, make this a real. If you comment on our videos, I'm more than likely going to respond back to you. Right back in that same comment, because I've done it before. So if you ever get curious about something we talk about on one of these episodes, you can leave a comment, and I promise you I'm going to get back to it, and I'm going to give you an answer to the best of my ability, or I'm going to go find you one. But like, comment, subscribe, and share, and we'll see you again in the following couple weeks.